You're listening to the Sick and Good podcast. My name is Dustin Messick, RDN. I'm a cancer survivor.
My name is Dr. Colin Goodwin, and I'm a cancer survivor. We're discussing topics related to cancer treatment and recovery while promoting wellness.
To find a balance between sick and good.
That during the cancer process, both can be true.
The Sick and Good podcast is for educational purposes only. The podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment, and before undertaking a new healthcare regimen. Thank you for joining us for the Sick and Good podcast. Joining the conversation, we have Janice Baker with us. She is a registered dietitian with an MBA and is a certified diabetes care education specialist. Janice started practice in 1983, has experience in clinical acute care, outpatient, eating disorder treatment, home health, orthopedic, other preoperative surgery education, and oncology nutrition. She also has a private practice and consults with a variety of corporations. Welcome to our podcast, Janice.
Hey, thank you so much for having me. It's really a pleasure to be here this morning.
So how long have you been in the field of nutrition now?
Well, it seems like a long time because it has been. I started working as a dietitian in 1983, but got into kind of the interest of nutrition during my life growing up. I grew up with family that struggled with issues with diabetes, and with back in the 60s and 70s, there just was not a lot known about it, not a lot of great therapies, and a lot of people, my family really had some awful complications with managing diabetes, and I just didn't really get it. So when I got into college and I picked nutrition science as a degree, I didn't even know what that meant at the time that much. It was just a lot of chemistry, as you know, a lot of anatomy, physiology, sort of like a pre-med degree in a way. And it was a great foundation. And then as I got experience in my postgraduate internship, I just saw the evolution of how we manage not just diabetes, but other chronic disease management. And at the same time, we were learning a lot about eating disorders. This was back in the early 80s. Remember when we just didn't know much about that, very parallel at the same time. And everything seemed to overlap to a great extent, which fascinated me. And then getting through my career, again, 40 years, that's a long time of seeing a lot of stuff evolve. It just really just maintained being a very big interest, a big passion, and the learning never stops. I'm still studying for exams and continuing education even at this point. So it's a fascinating field, but it's a lot to keep up with because there's a lot of nuance to it and a lot of opinions and a lot of take, and it's exploded in many ways. So it kind of never stops.
Yeah, that's really interesting of what brought you into the nutrition field.
Yeah.
You were also talking about before our interview, you were telling me and Colin about your first exposure to oncology nutrition through hospice.
Yeah.
Could you talk a little bit about that?
Oh, yeah. That was one of these experiences, when you have this imprint in your mind about, things that influence you that you will never forget. This was while I was in college during the summer. I'd work at a local hospital where I grew up, very small hospital, but I got a job as an assistant to the dietitian, a diet technician. And my job was just to deliver food to patients and to help in the kitchen and make tube feeding formulas. I visited with the patients. They had an inpatient hospice unit, which is, comfort care for people at the later stages of life with terminal illness. And I visited these patients every day, and I was never exposed to this before. And just sat with them, asked them and their families what kind of foods they would like, comfort foods, things that would help them get through this part of care. And, you develop relationships with people. You want to do things that help support them and their families. And it was a profound experience because you realize nutrition is not just about carbs, protein, fat. It's connection, it's love, it's comfort. And as maybe a 21-year-old at the time, it was profoundly influential, and it still influences me today, knowing how food and nutrition is so meaningful in so many ways to people. It's not just about meeting the calorie needs and protein needs. It's much more than that. So that was a very, very important part of my education, even though it wasn't a formal part of my education.
Well, can you tell us about your work as a nutrition support clinician?
Yeah. So when I started my career as a inpatient hospital dietitian, did have some training in my internship as a nutrition support team dietitian. And this is just when the use of what we call artificial nutrition and hydration start coming to play, otherwise known as total parenteral nutrition delivered through feeding tubes and through central lines, IV nutrition. That was just starting to really come online more and more for nutrition support for people who couldn't take nutrition by mouth. Maybe they had a stroke, or maybe they had a GI tract that was not functioning. And then starting in a hospital in the early 80s, when this was really ramping up, I worked in the intensive care unit, critical care, medical surgical, where people had all kinds of different pretty severe medical issues, GI surgeries. So I got to melt that in real time, and also at the same time started consulting with home health companies that were then also supplying people on the outpatient basis or home health basis feeding tubes through gastro G tubes, gastric tubes, jejunal tubes, who couldn't otherwise eat normally, tube feedings, and then also IV nutrition through their veins because their GI tract was not able to be used for one way or another. And so I had to learn very quickly. And then that's what prompted me to get additional certifications as a nutrition support clinician to really understand this, because this is not just about preparing meal plans and helping people with education about what to eat. This is about providing nutrition support when they couldn't eat normally otherwise. This was also coincidentally at the time when the AIDS crisis was really, really high. This is when HIV and AIDS was really at the crisis level. We didn't have therapies for it. I worked in home health. I worked with inpatient AIDS patients who were really suffering from terrible malnutrition and GI issues. This was profound and something I'll never forget, but it taught me a lot, along with the compassion that they were going through so much that we couldn't do a lot about at that time. And so again, learning this other part of nutrition support, besides just meal planning and things with diabetes that I do a lot of. And I still am working in this area too, still maintaining my credentials in this area. So again, this is a whole nother level of nutrition support. This is IV, this is feeding tubes, this is helping people transition off of those therapies, helping people and their medical professionals decide what the best plan of care for these patients are. And this also includes oncology patients, because a lot of oncology patients, depending on what the therapies are and the site of the tumors are, need this type of nutrition support as well. So it overlaps across a lot of nutrition issues.
Can you tell us about the oncology nutrition practice group that you're a part of?
Yeah, so the Oncology Nutrition Practice Group is one of my practice groups through the Academy of Nutrition and Dietetics, which I find extremely valuable because it involves a lot of practitioners who are specialists in the oncology world. And a lot of them, that's exactly what they do all the time. So the shared information, support, and education and resources, not just for us as professionals, but also for patients that are available through that practice group, is very valuable, because we do know, just like in diabetes, very similar, the nutrition information and questions in the oncology world can be extremely confusing, extremely distorted, and must be very individualized. There is just like in diabetes again, which that's my specialty, there's a lot of fear, a lot of anxiety, a lot of issues with the impacts of therapies on taste, on appetite. So it's a very, very great resource to support us as professionals, but also as a resource for patients to sift out and help make sense of all of that information that they're getting maybe from a lot of sources that are not so credible.
Yeah, that's really great to be a part of that group.
It's so helpful. Yeah.
I feel you are great marketing for them because I am, after this podcast, I'm going to sign up.
You got to. It's worth it. It's totally worth it. Yeah.
Can you speak on the intersection of diabetes and cancer?
I sure can. And so because of this podcast, before we got on here today, I pulled up a couple articles. I love reading journals. I read all my journals and I read them all cover to cover because I really love the science of nutrition and all the things that entails. So I have a couple of articles here that I kind of brought up. For example, with cancer, sometimes there are therapies used in cancer treatment called steroids, and steroids are used in a lot of different disease management areas. I am one of those. I have asthma that gets bad sometimes, and I every so often have to take high doses of steroids to manage my asthma. It's one of the therapies, and it's not pleasant. And it has side effects, but listen, sometimes we just don't have a choice. We have to do this to get through certain issues, whether it's asthma or cancer or other types of diseases. So what happens with the use of steroids in cancer patients is that steroids like prednisone or there's other steroid formulations that can cause a side effect that causes what we call hyperglycemia, high blood sugar. It's a profound side effect among other things. And what we know is that the side effect of steroids that can cause your blood sugar to go high can have effects that can cause things like higher risk of infection, dehydration, just other stressors, and maybe poor wound healing. So these elevated blood sugar levels that can sometimes be called even secondary diabetes. This is also used in lung disease patients, like people with emphysema. They get secondary diabetes because of chronic steroid use. So we are seeing that this calls for perhaps treating the hyperglycemia, the high blood sugar levels, with diabetes medications. And there's definitely reasons to treat this because hyperglycemia, again, can cause symptoms, can cause increased incidence of infection, secondary infection, because that's part of the problem. And so there is different therapies that may be considered to be used depending on the patient. In diabetes, we used to just have insulin and one pill, and now we have all kinds of different therapies. So we have oral agents, which are like metformin. We have all different classes of oral medications, but we also have insulin therapy, which sometimes is really the best therapy. And when patients hear the word insulin, they're really scared. They think, once I'm on insulin, I'll never get off of it. But actually, insulin is sometimes needed very temporarily in the case of high blood sugar, secondary to treatment for cancer or other issues. And it's a temporary therapy that can be really flexible, actually, because we have a lot of newer insulin formulations now. And just to help them get through that time when their blood sugars are excessively high and can be harmful. And then once the steroid therapies are discontinued and blood sugars are normalized, it can be stopped. So people often think, oh, I'm using insulin, I'm diabetic, I have to use this for so much longer than I thought I would, but it's not always that case. Now, again, just like with diabetes and cancer, it's not just the medications, it's also what we call the lifestyle things that can be adapted to the situation. So certainly healthful eating, supportive healthful eating is important. Regular, consistent eating to support. My point was lifestyle, nutrition, medical nutrition therapy, like we do in diabetes and with oncology. So you want to make sure people are eating nutritiously, sufficiently, regularly to maintain their nutritional status. So regular meals, a variety of healthful foods, meeting their calorie needs, adjusting to their appetite and to maybe taste changes, perhaps looking at the types of components of their meals to help mitigate spikes in their blood sugar, and maybe using foods with a good amount of what we call soluble fibers, like oats and beans and these type of fiber-rich foods that also supply the gut with fuel to make sure that blood sugars are stabilized, enough protein to maintain lean body mass, enough hydration, because dehydration can cause high blood sugar in itself. Dehydration can be a problem. So healthful, regular meals adjusted to people's tolerance and taste level. That's where a registered dietitian really is important, to look at all these nuances of meal planning with diabetes and cancer, or high blood sugar and cancer. And then also, which I emphasize a lot, is also movement. So being as active as possible. It doesn't need to be crazy. It doesn't need to be excessive or tiring. But we also know that maintaining lean body mass, maintaining muscle with some resistance exercise, with breaking up sitting, that really helps glucose metabolism, and it helps maintain lean body mass that can be really zapped with both cancer and hyperglycemia. One of the biggest risks to health, and we know health outcomes in cancer and diabetes, is loss of lean body mass, otherwise known as sarcopenia, which really gets accelerated with chronic disease. And we need to keep that lean body mass there as much as possible, because muscle tissue is an endocrine organ. It processes glucose. It really is part of bone strength. Fractures and falls and frailty are a key. So both those things, nutrition, hydration, as well as movement, resistance exercise, combined are very synergistic in maintaining good outcomes, good quality of life.
I could relate to so much of what you just shared, just from personal experience. I was on Decadron, a steroidal medication. In our first episode, we introduced ourselves as well as our cancers. And since I had some of my cancers in my brain, they put me on Decadron, and they did not anticipate how high my blood sugar got.
Oh, yeah.
Got over it, and it just hit me one day. My whole family was out at Universal Studios, the City Walk, and all of a sudden I was super loopy, terrible headache, and I think that my blood sugar was probably above 300.
Yeah.
So we went to the hospital and they gave us insulin, and then from then on I was testing my blood sugar 3 times a day and taking insulin. And then also when you're on steroids, you gain weight a lot of times.
Yeah.
So it's really interesting. Obviously steroidal medication also helps with so many of the other side effects that you're having, like the headaches that I was having, pain. It really is a helpful treatment and intervention during cancer treatment. Those are the side effects, but it's kind of worth the side effects, and it is short term. Eventually I got off the medication. And I did want to speak to earlier my experiences with nutrition support. I think I was on TPN during some of my chemotherapy, which I believe is more higher risk, but I was not able to ingest anything at the time. So, and I do remember also being on an NG tube, which is really uncomfortable.
Oh, yeah.
And I feel like they probably messed up on my formulation, because so I had chemotherapy and there was a cyst in my intestines and split open.
Oh.
So they did a surgery and they put me on an NG tube, and then I lost so much muscle. Right before this chemo and this surgery, I was going to the gym every other day. I was really muscular. And I remember as soon as I got discharged, I was like, where'd all my muscle go? Like, how could it disappear in like a week or two?
So fast. It's amazing how fast that happens. And it goes so way fast and it takes a longer time to come back. Rehabilitation after is so important and so underrated. But prevention of loss of lean body mass, it's a big focus now in a lot of nutrition support. Now we are really focusing on that. Disuse of muscle, immobilization, the stress of illness, sepsis, hyperglycemia. Muscle gets eaten up so fast. So they're starting now more and more to involve like physical therapists and intensive care units, getting people up and out of bed, moving around, resistance exercise, even in ICUs, because we know what a hit that is.
Yeah.
But it's got to be very proactive. This is why when we were talking about my experience, when I would do classes for our pre-op patients, and I worked with pre-op orthopedic patients, I would say, this is your time. This is prehabilitation, we call it. You're going in for surgery, joint replacement or whatever. This is the time to build up your muscle, become as well nourished as you can. If you have a planned surgery, this is like getting ready for the Olympics. This is the time to build that up because you are going to lose something with the stress of surgery, stress of illness, stress of infection. So build up as much as you can beforehand so that, it's like money in the bank. So pre-habilitation, there is actually a lot of interest in something called ERAS, Enhanced Recovery After Surgery. It's, again, a pre-op programming to get people strong for surgery. This is a very big passion of mine. We are all going to get something. We are all going to have a surgery. We're all going to get sick with something. It's a default setting. So why not just be ready for it? It can't hurt, right? And I think that needs to be emphasized more.
Yeah, absolutely. I definitely agree with you. So I actually think you kind of touched on wasting, like muscle wasting.
Yeah.
So I'm wondering if there's anything else you can share about wasting around, because, cancer cachexia, which I wonder.
Cachexia, yeah.
Cachexia. See, there's that pronunciation issue I have. My speech impediments coming out in our podcast.
It's all right.
So I feel like you were kind of speaking to that just now, or I could be wrong.
No, that's part of it. Yeah.
Yeah. And so what are some of the challenges, like as far as nutritional planning around this?
Yeah. So this is a double whammy because we know there's an altered metabolism in cancer. Like you just give people with cancer just tons of food and everything, there's still going to be, it's an inflammatory issue and there's still going to be muscle wastage. It's just a part of the altered metabolism, and cancer just sort of depends on where you're at, what the stage of cancer is, where you're at in the part of the progress, and everyone's in a different place and cancer happens in different parts of your body. So, and you're different ages, right? You're at 20-year-old is different than a 90-year-old who has cancer because of the altered metabolism of aging. And so the point is that earliest you can in the game, like again, with anything, is to understand that malnutrition helps nothing. Over restriction helps nothing. People are getting so afraid to eat and so restrictive. And again, that fear and anxiety is so real. But we know that really good nutrition support and advice from a registered dietitian who knows what they're talking about in this area and can help sift out food fears and all this and make sure that we're adapting to maybe taste changes and chewing and swallowing problems and digestive issues and budget issues and access issues and ability to cook and energy to cook, and all these things are really taken into account. There's a lot of things we look at, but making sure people are well nourished, regularly hydrated, meeting their estimated nutritional needs that can change over time depending on what the therapies are, if there's surgery, if there's other things going on. And then also, this is just what in my perfect world would be working if it's possible with somebody like a licensed, trained physical therapist. I love physical therapists for so many reasons, who really knows how to assess people, how to assist them with developing a program of movement to maintain lean body mass, if that's at all possible. I think that would be a great part of this, to maintain lean body mass again in your skeletal muscle mass and inside, and to reduce the risk of falls and injury prevention. So I think that would be an amazing combination in anyone who has a diagnosis of cancer and is going to go through cancer therapies or surgeries or things like that. Because again, it's better to get ahead of the curve than try to catch up, which is sometimes really difficult to do.
Absolutely. And I know that when people have cancer, their metabolism isn't as efficient. So the energy needs to go up. And I know that there has been an argument made that like eating less food might actually be helpful. But then there's a risk of malnutrition, which, as you said, is only going to make things worse. So it's kind of like a catch-22. Right?
Yeah, I've heard and I've seen those things about fasting and cutting out foods, but I just don't see that ending well, honestly.
Yeah.
Because again, malnutrition is really hard to reverse in so many cases for so many reasons. And malnutrition, and this is from my work in the eating disorder field, restrictive diets, undernutrition really kind of affects the gastrointestinal tract. You're starving the gut. And then it freezes up, and then you get more GI issues because of starvation. You get constipation, you get bloating, you get dysbiosis because you're not getting enough food into the gut. And then, your appetite decreases, and then it affects your brain. Malnutrition affects your brain. And then you just keep restricting and restricting. And that's a really hard thing to unravel. So while maybe temporary things, maybe in some people made that benign, it's sometimes the downstream effects are just really damaging. And I've seen that happen, and it's terribly sad. And, nutrition is supportive. It's not curative, right? But it's an important support of this whole thing. And, the bottom line, we want to maintain functional status, independence, mobility, quality of life. And as I said in the beginning, joy of eating is super important. The emotional components of eating foods that are lovely, delicious, have meaning, bring joy to your life. That's nutrition too. If it's not joyful, if it's not pleasurable, it's not nutrition. It's got to be a very big part of quality of life issues.
Yeah, I totally agree with you. I did want to ask a little bit more about what disorder eating patterns have you seen with cancer patients?
Yeah, I have seen that for sure. Well, this is personally because I've had a couple of good friends pass from ovarian cancer in the past couple of years, and both women a few years younger than me and very intelligent, highly educated. One was a family physician, in fact. And listen, I can't blame them to wanting to do everything they could to get through this, but I saw them going to such great lengths to avoid certain foods and to restrict their diets, and ultimately likely didn't make much of a difference at all. And again, just the fear and the expense of following certain diets and restrictions, it really took a toll on them psychologically as well as physiologically. And so, this can really spin off into what we often call orthorexia, or even a restrictive eating disorder, because we know the nature of eating disorders is biopsychosocial. A starved brain becomes much more anxious, and then there could be genetics coexisting with that. And that in itself is dangerous. Malnutrition eats away at your heart. You have cardiac issues. You have bone density issues. And that on top of a cancer diagnosis, it just adds to the complications. So again, online, it's flooded with fear mongering and all these things and misinformation, fasting. But is that really right for this individual? Is that going to contribute to quality quantity of life, a likelihood of a remission. We got to really question these generalities that we find in books and online. And, while it sounds, oh, well, if your appetite's bad, it must mean your body just doesn't need the food. No, it doesn't mean that at all, because appetite can be affected by so many things. It doesn't mean you don't need nutrition support, right? Because you're still going to have profound muscle wasting. You're still going to have a GI tract that locks up because it's not getting anything, and muscle tissue that's going to be wasted away because it's being used to supply your body with fuel. So appetite is very powerfully impacted by many things, hormones and other things. We're seeing that in other settings too. But it doesn't mean your body doesn't need nutrition support to get through a pretty severe situation.
Yeah, absolutely. And I also wanted to comment that I notice in diet culture in particular, there seems to be a lot of like anecdotal evidence, which is like really based on personal observation. I know when I was younger, it was easier to fall into these traps like, oh, well, they're saying if it works for them, it could work for me. So I think I'm going to do the all banana diet. Like fruit is good. I guess protein is toxic. Like I don't want the nitrogen. Like, and it's not science or evidence based. It's just this personal experience. And the scientific community, we know that there's different weights of different evidence. I know that meta-analysis is usually like some of the highest weight as far as studies are, but I feel like case studies is like the lowest evidence on the spectrum of research. But as someone outside of the research world, a regular person who's just like engaging with different things on social media, they would see this anecdotal evidence and be like, well, their credentials, they say they're a scientist or they're an expert. So I think that what they're saying is true.
Yeah. Well, everyone can be an expert in their opinion, right? It's just like I can say to myself, I'm a celebrity. So, that's the thing is, there's this whole thing of eat like me, move like me, look like me, right? Does that play out? Eat like me, move like me, look like me. It doesn't work that way because there's so many other dynamics at place. There's social determinants of health. There's genetics. There's so many individual variations. There's age. And these things change as time goes on as well. So there's these influencers. I really took a long time for me to even understand what that word influencer meant because I wasn't brought up with this word influencer. I was like, influencers, it just means they have a lot of people who kind of look at them and follow them. Does it mean they have actual credibility? But they're powerful, and marketing is often much more powerful than the truth, right? You see that every day when you go shopping, right? It's automatically a holiday season because Costco put up the ribbon in their aisles. That's marketing. It's holiday season because the decorations are out. Is that really true? So we're influenced by a lot of things, and it's just using critical thinking, questioning, being curious, like, really, does that make sense? Who's trying to influence me? What's the agenda here? What are they trying to sell me? And that's really comes in when you mentioned, I have an MBA, which I got a long time ago, but it's really like, what's the agenda here? What's the outcome they want? Look at people's agenda when they're a nutrition influencer or professional. What are they trying to sell me? Because that's always an answer that's going to bring up some potential red flags.
Absolutely. I also wanted to ask, since we're on the topic, what is orthorexia? This is like a term I feel like a lot more recent, and I definitely think cancer survivors could kind of become orthorexic. So I wanted you to speak on this.
I could see how they could, because seeing this, being in the diabetes world overlaps a lot with cancer, and we do see it being said, diabetes can increase your risk of certain cancers along with weight-related influences of certain cancers potentially. It doesn't mean it's correlation versus causation. We got to look at that and consider that. But there is a lot of fear mongering in the diabetes world too, like don't eat this, and you shouldn't have this if you have diabetes. And is that really true? We got to sift that out as well. Similar kind of question. So we do know that healthful eating, including, I often talk about including in to the best of your ability, health supporting foods, fruits, vegetables, nuts, beans, legumes, whole grains, things like that. We know those support great health, including heart health, which affects both oncology and diabetes patients. They support a healthy gut microbiome. We know these fiber-rich foods from fruits, veggies, plant foods support good bacterial diversity in our gut, which is associated with better health. They feed the good bacteria. They create what we call short-chain fatty acids that protect the lining of the gut, help reduce the risk of bacterial translocation, protect your liver, protect your kidneys. I mean, it's all great. So adding in, I like this phrase again, add in, pressure off. Adding in fruits, veggies, nuts, plant-based foods, oatmeal. They could be fresh, frozen, canned. All those things are great. Nothing wrong with any of them to the best of your ability. And then when there are foods, certain foods that I just sometimes call, these are foods that bring us joy, which is part of nutrition too. Say you go to a birthday party or there's holidays coming up. These foods are not going to hurt you. Enjoy these foods in context of an overall healthful dietary pattern, and they're not going to hurt you. But when you see a piece of, like a special piece of pie that maybe your mom made, or a special dessert for a holiday or celebration, this is something that's just as important to include without shame, fear, or guilt, in spite of what we're told. That really adds to joy and quality of life. So this orthorexia comes from just being so fearful and anxious about food and all the things it's going to do to you. And that stress and anxiety about food hurts you more than the food itself. This is what I tell my patients with diabetes. The stress, anxiety, and fear about this whatever, dessert, piece of pie, that probably raises your blood sugar more than the food itself. And so this is where we're at right now, is this over anxious problem about enjoying food in the context of healthy dietary pattern, which includes also movement, sleep, hydration, all the other things that impact our health. Food is just one part of it. We have to kind of pull back and look at the context of things. So that's kind of some of it. But orthorexia is a thing because, again, it's fueled by all this profitable fear mongering, fear sells stuff. And that's kind of what we're seeing happen.
I agree about the context is key. I feel like a lot of nutrition information is true based on the context, but when taken out of context, it could be completely inaccurate. So that's like a common debate I see in the nutrition field, especially from different disciplines of nutrition. It's like, what's the context? Like, what are we talking about here? Do we have to make it so complicated? If you're going to your grandma's house and she made a pie for you because, that's her way of showing love, and you're saying, no, grandma, I'm not eating this. Like, how's that working out for you? It's not. It's not. It's sad. To me, that's sad that you have to be that way, unless there's something really medical going on or whatever, which I'm not talking about that. But you just got to look at the bigger picture. You got to zoom out, look at the wide angle lens, and see how this falls into place.
Janice, can you speak to some common nutrition-related problems that you've seen in the cancer field or with cancer patients?
Oh, yeah. So first of all, depending on the therapies, we can see taste changes, right? So certain medicines, and this goes for many medicines in different areas, people lose maybe sometimes sense of taste. Things just don't taste right. And that's a big deal when you can't taste things right. It's like, it's not as appetizing. There can be sometimes issues with like dry mouth, which makes it hard to chew and swallow things. So chewing and swallowing issues, sometimes dental issues, that can limit oral intake. And, that can have a downstream effect to deteriorating nutritional status. So again, appetite changes, gastrointestinal changes, again, medications can cause these side effects. This is why I always love, as one of our team members is pharmacists, they can tell you about side effects. They can tell you about sometimes how to address these side effects of any medications. So if your appetite really takes a hit, okay, how do we fill in the gaps to make sure we're not losing important nutrition intake and maintaining your lean body mass and maintaining your nutritional status? So if you now know your appetite's taking a hit, how can we make up for those gaps? Maybe other ways in terms of filling in between meals with high nutrition, calorie density snacks, maybe sometimes oral nutrition supplement drinks, maybe just other creative ways to make sure we're getting in the calories and the nutrients to maintain your strength to get through the therapies. Because sometimes therapies need to be stopped because people become so weak and debilitated or get secondary infection. So remember, nutrition is supportive. It's sort of a life jacket. It's a life preserver to get you through these therapies. Other nutrition issues that may come up as a side effect of medicines or poor oral intake could be constipation. I can't talk about constipation enough because that's a really miserable thing for a lot of people. Sometimes pain medications can cause that. So definitely having a conversation with your physicians, either your oncologist or your general doctor, about therapies for constipation. There's different therapies that can be helpful. What the best ones are really depends on the person. Maintaining good hydration. So that could be part of constipation, part of also making sure you're getting good nutrition. So a lot of my patients who are dealing with these things, I'm recommending, listen, liquids sometimes can be easier ways of getting nutrition in. So things like juices, oral nutrition supplements, whole milk, other ways to get liquid forms of nutrition in because it's not as burdensome sometimes as solids. It still gives you calories. It still gives you great nutrition. It can keep you hydrated, keep the GI tract moving along. So those are some things I use. And then again, making sure you're getting adequate, just overall adequate fuel in your body, just overall adequate calorie intake so that you do have the energy to move and to do the activity to maintain your lean body mass. Remember also, and this is what I see in my eating disorder patients, inadequate calorie intake screws up sleep. So if you're not getting enough fuel, enough calories, your brain becomes very anxious. This is a biological wiring thing, and I think it's fascinating, but our brain is primed just prehistorically to stay awake if it's not getting nutrition because it's primed to seek out food. So if you're adequately nourished, it's more likely you're getting the sleep that you need. And sleep also is a determinant of hormones that control blood sugar, blood pressure, blood cholesterol, and appetite regulation. And sleep is a very big hit on quality of life and health. So getting adequate nutrition, however we can, really helps getting restful sleep so you feel like doing things and moving around during the day as well. So that's sort of a summary of it.
And I think that kind of speaks to, I think, one of the most common side effects with cancer treatment is fatigue.
Oh, yeah.
And I'm curious if there's any other recommendations you might have for cancer patients that are experiencing chronic fatigue, as far as then prepping for meals or then adjusting their diet.
Yeah. So fatigue, again, happens for many reasons. Just the stress, first of all, stress is really tough. The medication side effect, just being ill makes it really tough. So with fatigue, again, getting enough rest, but breaking up sitting during the day, just gentle movement, doing stuff around your house, just household chores and things that can, again, stimulate your energy levels and maintain your muscle tissue. So fatigue can add to itself if you're just really super sedentary. But again, with cooking and eating, be gentle on yourself. Don't be afraid to get and use pre-made meals, frozen meals, pre-prepared things, chopping and cutting and cooking and standing over a stove. That's exhausting. It doesn't need to happen. So getting pre-made meals, things that are already prepared. There's lots of choices out now to help conserve energy, whether it's foods you order out or things that you can just pick up at the store and reheat, oral nutrition supplement drinks. There's a variety of those. make it easy on yourself. Cut up fruits and vegetables. Canned fruits and vegetables are fine. Frozen fruits and vegetables are fine. Really save yourself the labor. There's nothing wrong with that at all. It's very important to conserve your energy.
Well, I understand you were a guest speaker for a breast cancer support group.
Yeah.
And I was curious if there was a particular approach that you had taken to the topic of supportive nutrition.
Yeah. So that was a great group because, again, these patients came in with a lot of very similar questions. They were anxious about eating certain foods. They've heard things. They were worried about this. So basically, it was, first of all, listening is always the most important thing I do, listening to their fears, listening to what they're told. A very important thing, this just was a very hot topic that's come up in the last day in some of my news feeds about supplements, right? Vitamin and mineral supplements. I should take turmeric. I should take vitamin C. I should take this. And I really want to emphasize, listen, this is a really concerning area. There's just not a lot of good evidence that all these supplements that are being hawked are helpful. In fact, they may be dangerous. Just in the past day, I have an article that I've just seen in a couple different ways that excess intakes of vitamin C and these antioxidants actually promote tumor growth because they promote vessel growth in the tumors themselves. They're actually promoting tumor growth. They're not helpful. Turmeric and other supplements you find are unregulated. They may be infiltrated with damaging and harmful substances because who knows where they're made. And so all these supplements that are touted, it's a very big business, 90% profit margin, unregulated, can cause liver damage, other side effects, but the promises and the marketing are so powerful. So all these supplements that are being promoted and hawked by people, again, who only want to make money off of you, that's another whole issue in itself that I often address. So getting nutrition through food and nice meals and food that you eat is safe and very important, but the supplements can actually cause liver damage, and your body's already going through stress with the medications that your liver has to process. So they're natural does not mean safe. Remember, natural is a shark bite. Natural is poison mushrooms. Natural does not mean safe. So natural is a marketing term, but it doesn't mean anything about safety.
Yeah, it just kind of make me think if Justin did go full banana.
Yeah, or that snake oil that you're going to take that's going to really help cure the cancer.
It's promising, right?
Yeah, it's like, oh, they're suppressing the truth. Here's this secret thing. I remember the big thing was goji berries. There's
there's always something.
Super antioxidant that was going to cure all of cancer. It's a superfood. I'm like, broccoli is a superfood.
Mm-hmm.
Like
it is.
Broccoli sprouts. We already have tons of superfoods. They're always looking for something new that's better.
Yeah, it's never going to stop. Actually, in my opinion, prunes are superfood.
I've been drinking a lot of prune juice lately. I really like the flavor.
They're good for your bones. Yeah.
Do you feel super?
You got to be careful, though, because I was getting a little too into it, and it can lead to a lot of bathroom visits.
Oh, it can. Yeah. Anything can be overdone, right?
Yeah. I mean, even like the magnesium supplements, when it's cold, they're like, take some magnesium. And you're like, wow, I can move so well. And then pretty soon you've taken too much and you're in the bathroom a lot again.
Yeah, exactly. Right. You can overdo everything.
Tell us about your weekend, Dustin.
Yeah.
Well, Janice, we wanted to thank you so much for being able to share your expertise and just talk about these topics on nutrition with us today.
It's my pleasure. This is great.
Our podcast will discuss topics related to cancer treatment and the recovery process, including diagnosis, family support, resources, medications, and nutrition. We aspire to have conversations pertinent and relevant to the cancer journey.
Thank
you for listening to the Sick and Good podcast. We'd like to invite you to connect with us on our social media at Instagram and Facebook accounts. We're also happy to share that we have launched the Sick and Good podcast website, sickandgood.com. This website is a place to read our bios, subscribe to the podcast, listen to full episodes, or read full transcripts, and contact us with your questions or comments. We care about your listener experience and would love to hear from you to keep the conversation going on the topics of cancer and wellness.